started with some breathing. So if you happen to have bolsters, you can use bolsters. If you have blogs, you can use blogs, or you can be flat on the ground. I'm more than happy to have you put your legs up the wall too, if that's your preference. Really great for immunity. You're gonna come down really slow, one disc at a time. Once you're all the way there, walk your feet to you. Take the feet together and the knees wide. You can lengthen the spine away from the pelvis if that makes sense to you. If you have blocks and you want to put them outside your hips, you can. That'll provide a lot of support. Or you can do without. Both are great. Lengthening pubic bone away from navel, lengthening inner groins to inner knees, drawing the outer knees toward the outer hips. Let the arms be heavy beside you, arms closer to you to feel less, arms higher to feel more. Think about pulling the femurs toward the hip sockets, pressing inner heel and outer heel toward one another, big toe mound, baby toe mound. Take your attention to the lungs. With each inhale, feel the abdomen expanding as though it were a balloon. With each exhale, feel the abdomen contracting, lungs emptying. Continuously focusing on the movement of your abdomen, the movement of your lung tissue. More rounds of breath, abdomen expanding, contracting. Returning to your natural breathing, adjusting the legs at any time. Reach your fingers towards the ceiling, lengthening the arms. Take right hand to left elbow, left hand to right, squeezing opposite elbows as you pull the elbows apart. Elbows reach toward ceiling, upper arm bones sink toward floor, elbows lifting, upper arm bones sinking. Three more. Then extension, no tension. Take your elbows toward your legs, toward overhead. It can be nice to make circles here as well, if you fancy it. And then once you've moved your shoulders sufficiently, taking your forearms to your forehead, maybe over the crown of the head to hover or to rest on whatever height you might want to place there. You could put a block or a book, whatever you've got handy. Taking your attention to the rib cage. With each inhale, imagine the rib cage as an accordion that could expand up into space, out to the sides. With each exhalation, feel the rib cage contracting, lungs emptying. Imagine your rib cage could expand out in every possible direction as you inhale, feeling the rib cage contract from every possible direction towards the spine as you exhale. Continuously focusing on the movement of the rib cage, the movement of the lungs within the space of the rib cage. can adjust your position at any time. 5 more breaths, ribs expanding, contracting. Natural breathing once again. If the elbows are overhead, bring them in front of you. Lengthen the fingers towards the ceiling. Stretching the arms. You can draw your knees together whenever you like. If it feels great, you can stay longer. Left hand to right elbow, right hand to left. Squeezing opposite elbows as you pull them apart, finding that resistance. Every digit equally contributing, especially little fingers. Elbows lift to ceiling, upper arm bones sink to floor. I like to think of taking the outer upper arm toward the end of the mat, the inner upper arm toward overhead, an external rotation of the upper arm, wrinkle-free wrists if I can. An extension, no tension, elbows toward legs, toward overhead. If you did on the other side, you might want to work with some circles. Three more repetitions if you're going toward overhead and toward legs. Evening out your circles if you're making circles. Very good, and then forearms come to forehead. Maybe they hover over the crown of the head, maybe they rest on the floor, or you put some height underneath. Say a block would work, or anything that resembles a block. Lots of possibilities, you can always change your mind. Attention goes to the upper chest and shoulders. Inhale to feel the chest lifting, the shoulders expanding. Exhale to feel the chest sinking, shoulders contracting. Continuously focusing on the movement of your lungs within the space of the upper chest and shoulders. Perhaps you can feel the breath wrapping around toward the upper back. Five more rounds of breath. Returning to the natural breath when you are ready. Elbows come in front of you, lengthening fingers toward ceiling. Resting, arms heavy beside your body. Support your legs, draw your knees together. You can either have the knees and thighs literally touching, or you could put a block between your thighs, like this. Both work. You're gonna walk your feet apart so the outer edges of the feet are parallel. You're pigeon-toeing the feet a little. Just in case we forget this one. Now, snowplow or preparation for Virasana here is very, very good for our knees and lower back, as long as it feels good. If it feels like too much, it probably is, in which case you bring your feet closer together. It'll reduce what you feel significantly. Let your arms be beside you, closer to feel less, higher to shoulder height to feel more. You could even do a 90-degree angle bend or reach the arms toward overhead, whatever felt really good, whatever was really comfortable for you. Sometimes I stack the palms or interlace the palms and place them behind my head. That can feel quite nice too. Big inhale to fill the lungs, full exhalation to empty every last drop of air, and then inhaling to fill the abdomen. When the abdomen is full, breath spills to rib cage. When rib cage is full, breath spills to upper chest and shoulders. We empty the lungs from top to bottom once they are full. Continuing with this wave of breath, up and down the spine, continuing to squeeze the thighs as you draw the ankles apart. Inner heel to outer heel. Three more waves of breath. Feeling the front of the body, the sides of the body, the back of the body, all expanding, all contracting with each round of breathing. With your next exhalation, natural breath, release the arms low to your body. Walk the knees and ankles to touch. If you've got a block between your thighs, put it beside you. Draw the knees toward you. Take your hands to your shins, maybe interlace. Go a little side to side. Pulse the thighs to you, away from you a little. Try to spread your toes and squeeze the legs together. And turn that into some circles. Go the other way with the circles. If the hands are interlaced, swap the interlacing. Opposite thumb and forefinger dominant. And side to side. And remember, you don't have to use your hands on your shins if it doesn't feel good or it is painful or anything like that. Use a strap. Use whatever you've got over your shins. Elbows on floor. Fabulous way to do the same thing. You can even do one leg at a time. And thighs to you, away from you a little. And then take the knees a little bit wide. Hands can be on the front of the shin or the front of the knee there, or behind the thigh, depending on what's more comfortable. And then side to side a little bit more. Pubic bone lengthening away from you. A couple circles, each direction. And side to side once again. Think about taking the hip creases away from you as you draw the knee toward you. Like this area, toward the end of the mat. Very good. Then coming back to center, bringing left foot to floor. Let's cross the right leg tightly over the left, so there's no space between the legs. Squeeze the legs firmly. Think right hip toward end of mat, pubic bone toward end of mat. I like to move the pelvis a little bit at first, so imprinting and arching, going back and forth. Here I'm arching my lumbar, then I'm imprinting. Pubic bone lifts, pubic bone lengthens. And then right hip away from armpit, toward armpit, left hip away from left armpit, toward armpit. And then right hip closer to floor, left hip closer to floor. And then find as much neutrality as you can. Hip bones equal distance from shoulders, floor. Pubic bone lengthens. Squeezing legs together, maybe you pull the thighs apart. If you need more, you can walk your left foot closer. You can lift your heel. You can put a block of any size under your foot. Or you can use hands or strap to bind. If you've got the strap, you can rest the elbows on the floor, which is a nice way to work it. You can push and pull here if you're using the hands. If you'd like to point and flex, this is a great option as well. Think inner upper arm toward ceiling, outer upper arm toward floor. Circles. Go the other way. Flexing, curling, pointing, flipping. Flexing, curling, pointing, flipping. Once more. Good. And flex your feet and hang out here. If you like to do the leg lifting option, you can push your palms into the ground and lift and lower the legs if you prefer. A little bit of core, strengthening the buttocks, the thighs in general. Usually gets more into the glute though, I would say, in the trochanter. And you can add more work if you like by interlacing the hands at the head. Either lifting and lowering the head like you would sort of in a crunch sort of position, or you could keep the head up and lift and lower the legs, or you could say lift the legs and the head at the same time and then lower them at the same time. Yeah, those are all good possibilities. As is having your foot on the ground or on a block or using your hands or your strap. 10 more breaths. Move as much as you like, be as still as you like. Let your focus be strong. Keep your gaze fixed or your eyes closed, regardless of which option you select. Good. Releasing left foot to ground now. Right ankle slides to left knee. Left foot is in line with left sit bone. Like so. Thread the needle, figure 4, lots of names for this one. Your right foot is flexed. You're hinging the right knee and thigh away from you. That's important. The hip bones are equal distance from the shoulders and floor. And again, you can imprint an arch here. You can take right hip away from shoulder, left hip away from shoulder, right hip closer to floor, left hip closer to floor. And then find as much neutrality as you can in the context of the asymmetrical posture you're in. Hips equal distance from shoulders and floor, pubic bone lengthens, you're pulling the femurs in toward the hip socket. If that right foot, can flex quite a bit, I like to take the baby toe edge of the foot and hook it around the outer left knee, and then I can pull my knees apart. That makes it easier to pull my femurs to my hip sockets. If I need more, I walk my left foot closer. If I need less, I walk it farther away. If the foot's quite close, I still needed more, I could add a block under my foot if I wanted to, but I wouldn't let that change the weight distribution in the pelvis. I'd keep it level, or I could use hands or strap to bind. Right? Lots of options. Select one that works for you. If you're not sure, you can always ask. And if you're doing a recorded version of this class, you can email me. 10 more breaths. If you are binding, I often like to straighten and bend the left, or whichever knee is not already or is able to straighten and bend in this position, but I don't let my right knee come toward me in order to do so. Just another little option if you want to get into the left hamstring a little more, left calf a little more. You're thinking inner upper arm to ceiling, outer upper arm to floor. Good, and then left foot coming to ground, draw the right knee towards you, reach your right heel towards the ceiling. You can use your hands or your strap. If you have just your hands, use your hands behind your thigh, right hip away from right armpit, left leg, straight, bent, somewhere in between. A little bit of bend in both knees is nice often. If you have a strap, you're welcome to take it over the sole of the foot if you want to, either elbows on floor or hands walking up strap. So either this option or this option. Both work really well. Think about taking the right hip to the end of the mat, outer shoulder to the floor, armpit to the ceiling. And you can walk the left foot a little further away rather than all the way if you like. Sometimes it's nice to flex the left foot too, and it gives you a little more oomph and a little more control over that left knee. If it wants to wander out, you can avoid it. Imagine you're dragging that right heel down an imaginary wall as well. Take that right hip away from you a little more if you can. Maybe you take the right leg towards the left. And again, you can use your left hand on the strap. You can use both hands on the strap, elbows on the floor. You could have your hands behind your thigh. All of these are good ways to do the same thing. Feel too much, you bend your knees more. Feels great, straighten your knees more. Find more muscles. Think of squeezing the outer thighs together. Maybe pulling the inner thighs apart. A little bit of both goes a long way. 5 more breaths. Right on back to center once you're there. If you've got a strap, put it beside you. Bend your right knee, interlace over the shin, give it a hug, and release both feet to the floor. Knees and ankles touch. Knees in line with pubic bone, in line with your abdomen. Left leg crossing over right. Squeeze the legs together. Pubic bone lengthening, and I often like to move a little bit into my pelvis at first, so pubic bone lengthens, and then lifts, imprinting, arching, going back and forth, moving my pelvis as much as I like here. Then if I want, I can take right hip to shoulder, left hip to shoulder, so I'm shortening the distance, from the hip to the armpit. So I'm shortening on one side, shortening on the other. And then the last one, right hip closer to floor, left hip closer to floor, right buttocks closer, left buttocks closer, right side of sacrum closer, left side closer. You can also think of pulling the right femur toward the floor, the left femur to the floor, if you want to get more precise about it. Then eventually, hip bones equal distance from shoulders, equal distance from floor, pubic bone lengthens, you're squeezing the thighs, and maybe you can pull them apart. If it's enough to squeeze the legs, don't worry about pulling them apart. Trochanterics are really useful here. If you can squeeze the lower part or the upper part of the hip, it makes a big difference. You can stay still. You can walk your foot closer. If you feel too much, you walk your foot farther away. If your foot's quite close, you still want more, you can add a block under your foot, any height you like, or a book, whatever you've got handy. Those of you that have ordered blocks with me or mats or whatever, the order is in. You're just waiting, and they have already shipped it. So it shouldn't be too long. Anyways, you can bind if you like, using hands or using strap. All right, all of these are good possibilities. Pointing and flexing once you've arrived. If you prefer to stay still, stay still. If you use your hands or your strap to bind, you're pushing, you're pulling. You're moving in 2 directions, if not more. Circles. Go the other way. Flexing, curling, pointing, flipping. Flexing, curling, pointing, flipping. Flex your feet to hold. Try to get the big toe mounds, baby toe mounds equal distance from you, spreading your toes. Either stay as you are, Binding, not binding, foot on block, foot on floor. Or you can do some leg lifting if you like, alternating legs coming toward you and away from you. I like to flex my ankles and just tap the right heel on the floor as I go. Your outer shoulder is to the floor, the palm is pushing into the ground firmly here. You don't want to lift the outer shoulder here. If you lift your outer shoulder, it's a lot of work for the lower back. Glue those shoulders down, take the abdomen and the ribs to the ground, then you're going to be working the part of your body that you actually want to, instead of going into the areas that are A, already strong, B, are going to cause you pain, right? You want to be using the whole body in conjunction here. So a little bit of everything, not too much of any area in particular. Equally distributing the effort, equally distributing the tension. If it feels great, this is fabulous, you really want more, then your hands can interlace at the head. It would be the opposite, thumb and forefinger interlaced as last time. Elbows are as wide as shoulders, not wider, not narrower. Just to give you a visual of that. You don't want your elbows super close, you don't want them super wide, you want them as wide as your shoulders. You're reaching them up away, you're pulling them in, you're moving them in and out. There's a lot of resistance there. If I were to touch that elbow, it wouldn't go anywhere. Super, super strong elbow. Anywho, you can lift the head to hold, lift and lowering the legs. You could lift the legs and then lift to hold and then lift and lower the head, a little bit of like a crunch or a sit-up with the yogi style. You could lift the legs and the head at the same time and lower at the same time. You don't want to change the neck. So regardless of what option you pick, you're not letting your chin change. You're not tucking your chin. You're keeping a neutral neck the whole time. 10 more breaths to move or to be still. And if you do the leg lifting portion, try not to let one side of the body shorten over the other. Think left hip away from left armpit, especially as you draw the legs to you. Keeping that natural curve in the neck. A nice way to think about it is you've got like a little apple under your chin and you don't want to crush it. Or say, let's say an egg. An egg would be a good one, because if you crushed it, you would have egg all over yourself. Good, and then right foot coming to floor, releasing the arms. Slide the right foot in line with your right sit bone. Slide the left ankle to the right knee. Your left foot is flexed here. Your hip bones are equal distance from shoulders and floor eventually. You might want to move a little bit here. You can imprint an arch. Pubic bone away from you, toward you. You can shorten on one side and then the other, working with how close the hip bones are to the armpits respectively. And then you can put more weight on one hip than the other. Pulling one femur to the floor, other femur to the floor. And eventually trying to find neutrality, lengthening pubic bone from navel, hip bones equal distance from shoulders and floor to the best of your ability. And it's really useful to take your fingertips to the iliums or the hip bones at the front of the pelvis. It'll make it so much easier. Lengthening left thigh, left inner groin away from you. Don't let it come toward you, but keep it away. If you need more, you walk your foot closer. You need less, walk it farther away. You can play with lifting your heel if you need more. You can put a block under your foot. You can use hands, you can use straps for binding. If you're using the hands, you can press your forearm and left thigh against one another if you like. If you're using the strap, you can have your elbows on the floor and then get a little bit more lift in the armpit, which can be really useful, not only for the neck, but for the elbows too. Odd, I know, but so helpful. 10 more breaths. And should you want to, and should it make sense, the outer left foot here, or baby toe edge of foot, it can hook around the knee and you can pull those knees apart. If that makes a lot of sense, pulling those trochanter's in, or femurs in order to find the trochanter's, it'll be that much easier. And if you're binding, you're welcome to straighten and bend the right knee if you want to, if it seems reasonable. It is certainly not important if you do or not. And we keep using the mind to keep that left thigh away from us. right knee bending if you straightened it. Release the right foot to the ground. Draw the left knee towards you. A few options. Hands can be behind thigh, left thigh, thumb and forefinger dominant. Left hip toward end of mat, outer shoulder to floor, armpit to ceiling. You can straighten your knee here, and it doesn't matter how straight, do not force. Or you can use a strap, if you have one, or a tie, or a bathrobe, or whatever, bathrobe strap, or whatever you've got handy. An actual tie would work. Straighten as much as you like, do not force. If you've got the strap, you can have your elbows on the floor if you like. I like to, instead of having my wrist quite close to me, which I often see, like this, see if you can stack the wrist right over the elbow. It'll give your wrists a little bit more of a break, so you don't want too much of a bend in the wrist, it'll irritate them. Or at least it can. You can also walk your hands up the strap until the arms are straight, pulling the elbows apart just a little bit, trying to keep a straight wrist if you can. Or hands, whatever you like. Right leg can be straight, right leg can be bent, it can be partially straight. If you partially straighten, it's nice to have the center of the heel on the floor rather than work the sole of the foot down. Less likely to cramp, and also will give you more control over your knee. You don't want your right knee rolling out. You're pointing your knee and your toes straight up to the ceiling. Outer left hip, not shortening, but drawing toward the end of the mat. Outer left hip toward end of mat. Lungs expanding, lungs contracting. And taking that left leg towards your right, either hands behind thigh, or if you've got that strap, you can have your elbows on the floor. You can take, with one piece of strap in each hand, or you can take both pieces into the right hand, bend elbow, straight arm, all good options. They all feel a little bit different. You want to spread the left toes quite a bit, right toes as well if you can. Think of squeezing the thighs together. If that makes a lot of sense, you can pull them apart too. Three more deep breaths. And returning to center, bend your right knee, bend your left knee, bring both feet to the ground. Now, if you've got a block, you're going to put it underneath your pelvis. If you don't have one, that's perfectly fine. You're going to push into the feet, lift the pelvis, put the block underneath at the low height, push into palms, shoulders, fingers. Have the feet at hips distance apart or wider. And if you don't have a block, stack a couple of books, or one book, and put your pelvis on a book. Push into the palms, shoulders, fingers, or a bolster. That would work too. Or a firm, any kind of height will work, as long as it's relatively firm but not too firm. Lift just the right foot, keep your knee bent. Push into the sole of the left foot, you can lift the toes if you like. And then see if you can straighten and bend that right knee a few times. Think right hip toward end of mat. I don't recommend turning your head in this one. Looking at the ceiling is ideal. And then straighten the leg as much as you like. It does not matter how straight. I like to keep it a little bit bent often. And then pointing and flexing. Toes reach to ceiling, toward you. Outer shoulder to floor. Inner upper arm to the ceiling. Point for circles. Change direction. Flexing, curling, pointing, flipping. Flexing, curling, pointing, flipping. One more. Good, and then bend that right knee completely. Bring the foot to the floor, hips distance away from the left when you're ready. Now see if you can lift the toes of the right foot, just the toes, toe mound stays completely down, optional of course. See if you can lift the left foot. And just lifting a little bit. And remember, you can do this without the block or with just a tiny bit of height under the pelvis. And see if you can straighten and bend the knee. We're trying not to move our thigh, so our thigh stays completely still. We are only moving at the shin. If the leg goes farther away from you, don't straighten as much. And then straighten as much as you like to hold. Doesn't matter how straight, you can bend as much as you like. And begin to point and flex the ankle. Trying to keep the right toes lifted if you can. Pointing for circles. Change direction. And flexing, curling, pointing, flipping. Flexing, curling, pointing, flipping. Once more. Wonderful. And then bend that left knee completely. And place the left foot on the floor, hips distance away from the right. Have the feet at hips distance apart here. You're gonna lift 3 times to remove your block. You're gonna lift, lower, lift, remove, lower as slowly as you can. Once you come all the way down, you can extend your legs for a moment if you like. You can bend or keep the knees bent and then hug the legs. You could also go a little side to side with the knees. Good, and then when you're ready to do so, bend your knees, hug the legs for a moment if you like. And feet to the floor, roll to the side, push yourself up. You can come onto your hands and knees. You can come onto blocks if you have them, or if you like using them. Well, I suppose you'd have to like them and have them. You can also use books or anything of that nature, wrapping the fingers around the front of them, right? You're also more than welcome to have your hands on the ground. And I'll just demonstrate with the blocks today. Think inner upper arm forward, outer upper arm back, pull the elbows apart if you're flexible in the elbow, tuck the toes, get a good grip. And then from here, rounding the back, tucking the chin, pressing the floor away, gaze lifting, sit bones lifting, looking up, spine rounding, chin tucking, pressing floor away, gaze lifting, sit bones lifting, looking up, continuing at your own pace. And if you don't have blocks, your hands are on the ground, you feel too much stretch in your wrists, bring your hands farther forward, bring them wider, point the hands out more. It'll reduce the pressure not only in your wrist, but in your shoulder too. Not to mention the elbows, the neck, even the upper back will be more free to move if the arms are wider. You can even reduce pressure in the lumbar, seeing as that whole spine is connected. Nice. And then neutral spine. See if you can get a pointed foot with a lifted front of the ankle. So you're pushing into the top of the foot, you're dragging the heel away from you. Just like so. So not totally flat, but big lift. And not as much as you can, but a comfortable amount, right? And then you think of keeping those feet as still as possible as you make circles with your hips, rather than letting them kind of wobble to and from. You'll gain stronger ankles and stronger knees as a result. The feet, of course, become quite strong too. Look just beyond your hands. It's a little bit of a tuck of the chin to keep the neck neutral. You don't want to be looking forward or looking down, but right in the middle. Change direction now. And ceasing the circles. Tuck your toes, get a good grip. Then from here, hips come towards your heels to the extent that suits you. It does not matter how far you go. And funny little tip, if you put a little something between, you can see I got a little block there at my heels, or at my calf area. And if I tuck that block or a rolled up blanket or something like that, a big thick one there, it'll reduce the pressure significantly. If pressure's all good, you can go as far back as you like. You can stack a block under your forehead, which I highly recommend. Whenever we've got more external stress, or any kind of stress of any sort, particularly when the entire world is affected, it's a very, very useful practice to do postures that require the forehead to be resting, and even more so if the forehead can be resting in a way that allows the skin of the forehead to slide away from the bridge of the nose toward the crown of the head, and where you can find a little bit of external rotation in the shoulder, along with some length in the thoracic or the mid-back area. Because we tend to hunch this area, and if we think of taking the mid-back through toward the sternum, pulling the collarbones apart, gives us a lot more space to move into, not only for the neck and the shoulders, but for the lungs too. We want to be able to expand those lungs as much as humanly possible these days. If you need more, you can extend your arms. You can lift your knees if you like. I like to start with a bent knee, and if I want to straighten my legs, I do. Sometimes I stretch more into my dog, but usually I look for more stability, lifting up the ribs, pulling the elbows apart, outer shoulder toward the back of the mat, inner upper arm rolling forward. And eventually you're looking for a pretty neutral neck. So in some versions you kind of sink toward the ground, but in my experience, especially if you're in a more flexible shoulder body, you want to keep some stability there. Remember, we don't lift the knees unless there's absolutely no pain in the shoulders. Now take up to 10 more breaths, whether the knees are up or whether your knees are down. Remember, this puppy pose, any version of it, is 100% the preparation for dog pose or Buddhasana. Some people call it Adho Mukha Svanasana too. Svanasana, pardon me. Good, and then lowering the knees if they are up. Let's let ourselves take a little child's pose, so knees a bit wide, big toes touch in, hips come towards your heels, maybe all the way, maybe part of the way. The arms can certainly be extended if that suits, so you can pop up out of the fingertips for a little bit more sensation in the shoulders if you like. You could rest a block under the forehead at any height you like. You can stack fists or palms under forehead. There's so many ways to find comfort here. Ideally, the forehead is resting on something, and again, you want the skin of the forehead sliding up away from the bridge of the nose toward the crown of the head. That's what you're aiming for. Feel the back of the body expand as you breathe in. Feel the back of the body contract as you breathe out. Three more deep breaths. Good, and then you're going to come forward onto hands and knees or onto your blocks. Take the right toes farther away than the heel, heel further than toes. And then hook the baby toe edge of the foot. Maybe bend your knee a little. And left toes farther than heel, heel farther than toes, and then baby toe edge of the foot. Maybe you bend your knee a little bit. All right. And then from here, let's come up onto our blocks if we have them. If we don't have them, I'll show you what to work on instead. So we're gonna do a lunge. You can do this from the floor on blocks. You can do this from the floor with no blocks. You can do this from standing. Blocks as wide as your mat or as wide as your shoulders, toes tucked, knees and ankles at hips distance. Right foot either steps forward between the blocks or scoots a bit forward. Maybe on the right hand, outer right side. So you bring your right hand block on the inside, you take your foot on the outside, then you can widen your blocks from there. All good ways to do the same thing. If you don't have blocks, your knees are bugging you, come up to stand in whatever way you like. You can have your hands on the wall, feet at hips distance apart. Left foot a little back, right foot a little forward. Feet at hips distance, and you can switch. And you can take your hands to your hips or to your right thigh if you needed more. Those of us that are using the blocks, once the right foot is forward, you can lift your left knee if you like. And what you're looking for here is to draw the right hip back down and in toward the hip socket as you kick your shin forward. You're lifting the left thigh up. You can bend your left knee as much as you like. Do not force it. Try to lift your abdomen, lift your chest. Use your fingers. You want to be able to lift up those blocks if you wanted to. 10 more breaths. And you can always go lower with those blocks if you're using blocks. Fingers, palms, fists, whatever you like. They all have value. Good, and when you're ready, lower the left knee. Send the hips back. Start to lift the sole of the right foot, and hands can be on the ground, hands can be on blocks, whatever you've got handy. Right? Right hip back, left hip a little bit forward. Just like so, like so. If it felt really good, you can bring your pelvis back further and sit on the pelvis. If you're not letting the right knee be a hammock, you're lifting that right knee up a little, right hip a little back. I'm not sure, some of you might want to balance. If you like strong elbows. Good. And then hands come back down, bring it forward. Back on blocks if you're using blocks. 2 ways to go back. You can either lift your knee, take a plank, and then lower, or knee is down, and right foot and knee goes back. All right, so either way is perfectly fine. Once you're in your tabletop position, feet and knees at hips distance, left foot forward, either between the blocks or on the outside of that left block. Or you come up and you are standing and you swap from there. Both work. Or all 3 work. You can walk your right knee back if you're on the ground if you like. You can lift your knee if it feels good. I like to not just lift my hips, but also sink my hips. I try to do both. So I think of my left hip drawing back, down, and in. My right hip drawing forward and up. I don't let my right hip sink, but I lift it. Concentrate on one spot. See if you can take 10 more breaths. And make sure you could lift a hand if you wanted to. Otherwise, go back to right knee on the floor. Do not force it. You should still be able to smile if I said something very funny. Good, and lowering your knee if it was up. Hips going back a little. Maybe stay on the blocks, maybe you're on your fingertips. You can bring your hips as far back as you like, or just a tiny bit lifting that foot, maybe just lifting the toes. You decide how much. You can take up to 5 more breaths. Those of us that bring the hips back, you can balance if you want to. Just make sure this knee is under your control. You're not letting it be a little hanging hammock, but it's quite strong. You can keep your hands on the blocks. Not too much lift, not too much rounding, right in the middle. All right, and then coming forward, hips go back, foot goes back. Let's bring our blocks in front of us to the lowest height beside one another. If you don't have blocks, I'll talk you through options in a moment. You'll be on your elbows. You'll squeeze those blocks with your palms. Elbows are as wide as shoulders. I like to round my back. And then do a few more cat-cow curls, rounding back, lifting sit bones, and then lifting gaze and sit bones. And then try to find that rounding of the back and hold it. Look a little forward to the blocks or to the floor, and then slide forward and back with the shoulders. Other good options include shoulder push-ups here, lifting and lowering knees here. Oh, and going forward and back with knees up. If we do not have blocks, here are a few ways to do it. You can put a book between your palms, of course. You can have your palms flat on the floor, like this. Or you can interlace your hands, right? Same concept, forward and back, knees up and down maybe, knees up, forward and back, whatever you like. I don't recommend looking super far forward, but a little bit forward can be nice. Take 10 more breaths, moving or being still, whatever position feels best. And here I like to think of squeezing my elbows together and pulling my wrists apart, even though I'm still trying to squeeze blocks or squeeze fingers together. You can also just lift the knees and stay there too. Or think about lifting the knees a little bit and stay there. Lots of value there. Long holds with precise alignment will help you concentrate, help you focus in all areas of life, and they make you stronger too, physically and mentally. All right, from here, you're gonna take a little rest. A few different options in terms of the child's pose. You can, of course, use a block under your head, which I really highly recommend. If you haven't tried it before, it's really nice. And if you don't have a block, like I said, use whatever you've got handy, as long as it isn't too firm. If resting the forehead feels really nice, you can extend the arms, or sometimes it's nice to sweep the arms back and clasp a wrist or a fist or something of that nature behind you. Lots of ways to do the same thing. Take 5 more breaths resting, whichever version you've chosen. Good, and then when you're ready, we're gonna do one more little lunge. It won't be a long one, I promise. Using blocks or using hands on ground, toes tucked. Remember to fold over your mat or add more height under your knees if you feel your knees at all, because this one your knees stay on the floor. Right foot comes forward, either between the blocks or on the outside of the blocks. Left knee walks back as much as you like. Point your foot, drag the heel away from you like we did earlier. Think right hip back, left hip forward. If you want to think about it more so, you're kicking the right shin forward, you're drawing the outer right hip back, down and in, right femur back, down and in, but you're equally kicking the shin forward. Chest lifting, abdomen lifting, you can stay right here. You have 2 options really. You can go lower with blocks, if you've got blocks. Otherwise you can be on your fingers, your palms, your fists. Or you can go higher and work on balance more. So hands could be on thigh or knee, hands could be on hips. Elbows could squeeze together. Try to find that lift in the right ankle. You decide where you want to have your hands. If balance feels really good, you could reach forward, clasp opposite elbows, and take your forearms up. Just 5 more deep breaths. Kicking shin forward, drawing the hip back, lifting up the abdomen. Then when you're ready, lower arms if they are up, bring your hands to blocks or floor, hips go back, foot goes back, left foot comes forward, either between the blocks or on the outside of the block. Walk the right knee back, point your foot. And remember, you can do the same lunge standing once more, no worries. Both will have so much value for the knees, the ankles, the hips. On the ground, benefits the wrists a little bit more as well, assuming it doesn't cause pain. Point the foot, drag the heel away from you, draw the outer left hip back, down and in, lift the abdomen, lift the chest. Either stay here or go lower. And if you're already on your fingertips, you can choose to go onto your palms. You can be kind of on I kind of call this like a chicken foot hand, for lack of a better way of putting it. You can be on your fists, of course. But fingertips is such a great way to make yourself stronger too. I'm thinking about trying to bend the knuckles just ever so slightly. Really, really good. That being said, let me go this way so you can see from the other side. You also might want to come up and balance, in which case you're finding the hips, you're keeping the stability of the pelvis. Maybe you come up just a couple fingers. Maybe bring your hands to the front of the knee. Think about kicking that knee and shin forward, keeping that lift in the back ankle. Or maybe your hands come to the thigh. Remember, the closer you are to that thigh, the more stable it'll be. The more you come upright, the harder it'll be. Thinking of the trochanter squeezing, the abdomen lifting. Pardon me. It's possible that it'll feel comfortable here. You can reach forward. This time would be left hand to right elbow, right hand to left, pulling the elbows apart to perhaps reach out. And when it comes to adding more in a lunge, base it on how you feel that day. Some days you'll want more, some days you'll want less. You want to listen carefully to your knees, your feet, your ankles, your hips, your back, your lower back especially. 3 more deep breaths. And it's especially common when we're quite stressed to have old injuries start to bother us again. So don't be surprised if you begin to feel all sorts of old aches and pains with all this stress. The more you move yourself in a moderate way, the easier it'll be on your body and your mind. Release your arms if they were up. Bring your hands to whatever height of block you're working on or to the floor. Tuck your toes, hips back, foot back. One more time, blocks beside one another, coming to the elbows, squeezing the blocks with the palms, or interlacing the fingers, or squeezing a book between the palms, or having the palms flat on the ground, whatever your preference. A few shoulder push-ups, and then extension, no tension. Try to look to the right, try to look to the left. And then get your neck neutral, see if you can look a little forward, see if you can look a little back. And if you want more, you lift your knees while you do this. The forward and back. I wouldn't look side to side if you had your knees up though, personally. But feel free to have the knees up or down, looking forward, looking back. And then look a little bit forward over to the floor. A little sliding forward with the shoulders, a little sliding back, knees up or not, you decide. Elbows are squeezing towards one another. You're trying to press into the whole circumference of the palm, whether the palm's on the ground or squeezing a block, or the palms are squeezing one another. Either way. Wonderful, and then allow yourself rest. Take a little child's pose. It's just 5 breaths. Head supported on a block, or your hands, or the floor, or a book, or whatever you got available. Good, and then when you're ready, we're gonna come forward. So, I've got a few options for you here. We're gonna do some work for our shoulders and elbows, and you can sit in a variety of different ways. If sitting on the floor just doesn't work for you these days, you can sit in a chair, no problem. You can sit on a couple of blocks, seated on the shins. You can sit directly on your shins if that happened to be comfortable. You can sit cross-legged. So I'll show you how a few of these look. If you're gonna sit on blocks, I recommend sitting on 2 stacked on top of one another, sitting back, and then if this is a lot, stay still. If you want more, drag the heels away from you, find a lift in the ankle and no wrinkles in the heel. And of course you can sit on blocks too. They do not have to be yoga blocks, doesn't matter. Another option, sitting straight on the feet. And if you squeeze your heels together, so if the heels are wide and you sit back, it'll be milder, versus if you squeeze your heels and sit back, it'll be a stronger stretch, okay? If you want to sit cross-legged, you sweep the legs in front, and you need to be free of knee pain here. So right shin in front of left, you'd walk the feet wide, you'd flex the feet, and you'd think of lengthening the inner groins to the inner knees as you flex the ankles. And try to keep the big toe mounts, baby toe mounts level. Maybe if that felt really good, you could point your feet and work more tops of feet. Either way is fine. If that feels really great and you wanted more hips, then you bring the legs together, you tuck the right leg under, the left leg over, and you stack your knees and you flex your feet. This one they call Gomukhasana, cow face pose. So regardless of the option you select, find a position that suits you, and I'll let you know when to switch positions if you're doing one that requires a switch. And if you do feel too much at any point, I want you to come out of your position, change it, stretch the ankles, stretch the knees, stretch the hips, and then come back to it when you're ready. All right? So from here, let's bring our fingertips to reach forward as though we were squeezing a block between our palms. Then we're going to slowly, and the whole time I want you to imagine you've got something between your palms that you're trying to crush, but you don't quite. And then slowly bring the arms toward overhead, about as wide as your shoulders, maybe a little wider. And then take the arms wide, palms facing up. Take them as low as you can, wrists in line. Try not to let the pinky edge of the wrist be lower, and then the thumb edge of the wrist. And then sweep the arms forward, palms are facing up towards the ceiling. We're trying to keep the wrist level. Good, and then palms face in. Squeeze the fingers together, slowly bring the arms up. Imagine you've got a block between your palms that you're squeezing. Ribs and abdomen draw toward the spine and up the spine. And again, take the arms wide, palms are facing up, trying to keep those wrists level. Keeping the palms facing up, sweep the arms in front of you. And then palms face one another, take the arms wide again. Once the arms are with the shoulders, take the arms up, palms facing forward. And then bring the palms to face one another, bring the arms straight down in front of you. Take the arms wide, palms face up. And then from here, you're gonna spread your fingers and squeeze your fingers with the palms facing up. A little bend in the elbow is useful. You wanna think about the head of the shoulder dropping, the elbow lifting. Pinky edge your wrist, thumb edge your wrist, equal distance from floor if you can. And then squeeze the fingers into fist, palms face floor. Bring the palm up and down or the fist up and down. Bend your elbows as much as you like. The more you bend them, the less you're gonna feel. And if you've got any pain in those elbows, this one is fantastic. However, you need to be pain-free or no more pain than usual whilst you're doing this exercise. Circles. Go the other way. Spread the fingers, palms up, palms down. And then palms towards you. Bring the thumbs slightly back. Right ear to right shoulder. Left ear to left shoulder. And remember, too much, go lower. Oops. Right back to center. Release. Big inhale. Big exhale. And then from here, releasing the legs, bring them in front of you. Or if you were sitting on the shins, you can come onto your hands and knees. You're gonna point and flex. or coming onto knees to stretch out the ankles and feet, up to you completely. Circles. Go the other way. And flexing, curling, pointing, flipping. Flexing, curling, pointing, flipping. And flexing the feet. Either coming back to sit on the shins once again, or sitting with the left shin in front if you're cross-legged, either feet flexed or tops of feet more down. You do not want to feel your knees. Remember, you can sit on as much height as you like. It does not matter how much height you sit on. What is important is you do not have pain in the knees while you're sitting. Then you can concentrate on what you're doing with your shoulders and elbows and so on. Last option, legs together, knees bent, left leg under, right leg over. Knees are lined up with one another. Both sit bones must be on the floor. One side is usually going to be tighter than the other. Often if you're right-handed, this side will feel a little tighter. It's possible. Opposite might be true for you though. You're flexing your ankles. You're trying to get rid of the wrinkles in the heels and the ankles if you can. Spreading the toes. Chest lifting, abdomen lifting. You're right on the center of the sit bones. You're not leaning back. You're not leaning forward. You're not leaning to one side or the other. As even as you can be. Pardon me. And then from here, you're gonna bring your fingertips to touch your shoulders. Bring your elbows together, bring them apart. Try to use every digit evenly. Forward circles. Especially little fingers, ring fingers. Remember, you can change your seated position anytime you like. You could do any of those work standing, you could do it kneeling, you could do it seated in a chair too. Backwards. And then take the elbows wide, straighten your elbows, bend your elbows. And I don't recommend going as straight as you possibly can unless you're really engaging the musculature. But even then, going almost straight usually has more benefit in the long run. As you go, you're trying to lift the pinky edge of the wrist up so that it's level with the thumb edge of the wrist in terms of distance from the ground. And you can always glance, check it out. Think of really strong fingers. And then take those arms wide. This time we're gonna flip the wrists. This is a really good way to release the ulnar nerve and the medial nerve that run through the elbow. Think shoulders dropping, ribs drawing to spine. If you want more, palms can face a little back or a little bit in between. Good. And then bring your right hand to your right head, or to the left side of the head, pardon me. Left arm out to the side. You're gonna reach the fingers towards the floor, spread the fingers, and then draw the left side of your head to the right a little. You're letting the elbows reach away from one another. A little bend in the left elbow is useful. Great for any like cervical neck stuff too. You wanna be really easy on the sensation. If you feel too much, repeat this one again with the arms both straight. Good, and then release the right arm, bring the head back to center. Bend the left elbow, take your hand, the left hand to the right side of the head, wrapping the fingers slightly. Very, very gently, head goes towards, or left ear comes toward left shoulder. Little tiny bend in that right elbow, if not a big bend. Very gently reaching the elbows apart. And then releasing the left arm, coming back to center with the skull. If it feels good, you can hold one more round. You can squeeze the fingers, bring the palms to face the floor, and then slightly back. Thumbs on the inside will increase what you feel. And here, you're looking to take the shoulder heads a little bit back and a little bit down, but very gently, right ear to right shoulder. And you can do the same thing with the arms resting, or the same thing with the arms swept behind you or resting in your lap. Turn your chin toward your shoulder slightly. Coming back through center, left ear to left shoulder. Maybe you turn toward your shoulder, maybe you don't. Head back through center. Last one if you like. Spreading fingers. Squeezing fingers, 90-degree angle elbows. Upper arm bones. Pulling toward sockets, elbows reaching away from sockets. Imagine you're reaching your forearms and your elbows toward a wall. It's just ever so slightly behind you. And then finger squeezing, circles with wrists. Same direction, same time if you can. Go the other way. Good. And then release. Big inhale. Big exhale. Releasing legs. Bringing right foot forward, left foot forward, depending, extending the legs, taking the hands behind you, pointing and flexing. If you were sitting on your shins and you'd prefer to come onto your knees and ankles and stretch out that way, feel free to do so. Both are great ways to get the same benefit. Circles. Feet apart if you want to make bigger circles. Go the other way. Flexing, curling, pointing, flipping. Flexing, curling, pointing, flipping. All right, from here, we're gonna finish with a couple of twists. So you can flex your feet, bend your right knee, right foot in line with left knee, left hand to knee, right hand comes behind. If you feel too much, go a little wider with the feet. You can also do this with both knees bent if you want to. That's fine with me. But generally, it's more comfortable if the left leg is straight. Feels all good. They can be together. If you want to point your left foot, you can. If you want to flex your foot, you can. In terms of arm options, your fingertips can be on the floor, which I recommend in terms of finger strengthening. You can have your hand on your knee, your forearm around your knee. Wrist is quite strong. Or you can take your arm outside your knee. Fingers together, fist, something like that is a really good option. Fingers together with a straight arm is the most traditional option. Fix your gaze or close your eyes. Generally, you want to get your ears with your shoulders before you turn your gaze. Only turning your head as much as feels really good. You don't want to force your neck. 10 more breaths. Twists are fantastic for the immune and digestive systems, respectively. Really great benefits for the respiratory system too, of course. The more deeply we breathe when we twist, the more effective they are in terms of strengthening the lung tissue, along with your immune system. Unwind nice and slow. Hands come behind you, lengthen. Release the right leg, lengthen again. Bend your left knee, left foot in line with right knee. Knees and legs can be together, legs can be a bit apart. Remember to change it up if it doesn't feel good. If it doesn't feel good, question why you're doing it. Do less of it. Right hand to knee, left hand is behind. I like to be on my fingertips. It's a little bit of a bend in the elbow, twisting towards the left. You can stay as you are with your hand on your knee. You could move to forearm around knee, straight wrist if you can, elbows pulling apart. Maybe you take your arm outside your knee, in which case your left knee, you're not letting it take a hike, you're pressing it toward the right arm so that the knee and the foot are stacking, right? Right foot, pointed, flexed, both work. Most traditional option, fingers together, straight wrist. But remember, you can get the same benefits here, right? Take up to 10 more breaths. Becomes too much, hands come out behind you. Hands come to the shin. Same shape can be done on your back too, right? Unwind nice and slow. Once you've done so, hands can come to shin, hands come behind you to lengthen, and then release the leg, lengthen again, relax. All right, I'm gonna give you 2 options for our final twist. You can either come onto your back. I'll show you the on the back version first. You come down nice and slow, you extend your arms, you bring your hips to the right, cross the right leg on top maybe, and then you bring your knees to the left. And you might come all the way to the floor, you might put a block underneath the outer hip. And I'll show you in this direction so you can see a little easier. So either block outside hip or no block outside hip. But you want to move your hips to the right, your knees to the left, flexed ankles, support for those hips if you feel a lift in the right shoulder especially. All right? If you want more hips, you would rather do a seated variation. Here is one more seated variation. It is more intense on the hips and knees though. So for some of you it's appropriate, some of you it's not. Be your own boss. Do not do something that doesn't feel good. Bending knees, both knees, tucking right foot under, left foot over. Both sit bones must be on the floor. The right foot is more pointed. You can flex it, but pointing is easier on the knee. Foot is flexed on the left. You're pushing into the feet. Hands come to the shin. You either stay here or your right hand stays and your left hand comes behind. You either stay there or you take your arm outside. Your right arm outside. You fix your gaze, you turn your gaze. And again, 10 more breaths regardless of which option you select. They're all valuable. Lungs expanding, lungs contracting. Focus on the lungs, filling and emptying to the greatest extent they can. Think about taking the right side of the abdomen and tucking it under the left ribs. Opposite if you're on the back. Alrighty, unwind nice and slow. Release. If you're seated, bring the hands behind you and extend the legs, supporting the legs as you do so. If you're on your back, bring your hips to center. Uncross the legs if they're crossed and swap the crossing. Take hips left, knees right this time. If you're seated, bending knees. It'll be left leg under this time, right leg over, pushing into the sole of the right foot, the top of the left foot. Both sit bones must be on the floor. You're not leaning back if that's the case. You want to find a neutral pelvis here. And if you can't find a neutral pelvis, you can repeat with the left leg straight one more time if you want, or do the version on your back, which I highly recommend. All of these twists are very, very beneficial. One is not more potent than another, if you will. It's about staying as much stillness as you can for as long as you can without pain at all. You can keep your hands behind. You can have your left hand on your knee, maybe your left arm outside your knee as you twist to the right if you're doing that seated variation. Concentrate on the movement of your lungs within the stillness of your body. And remember, if you're mind goes elsewhere, it's very normal. Just bring your attention back to the movement of the breathing whenever you notice it moving elsewhere. Good, and then unwinding nice and slow, releasing the legs, uncrossing, straightening out. And then if you're not on your back yet, coming onto your back now, and I'll talk you through setting up for Shavasana. You can also practice legs up the wall if that's your preference and you happen to have a wall handy. Similar alignments are relevant. Make a C with your spine, come down if you haven't yet. Extend the legs, extend the arms. I like to bend my knees again, have my legs together, and then roll my baby toes toward the floor, roll the outer edge of the foot toward the floor as I straighten, letting the legs be as far apart as you feel is necessary and comfortable. You can always put height under your knees. Lengthening the wrists away from the shoulders, lengthening the neck, clenching and relaxing the palms as much as you like. And then settling in, closing the eyes, and becoming as still as you can be. Try to resist the urge to fidget and adjust. Focus on your body, your breathing from the inside. Concentrate on being still. So I'm going to leave you here for your Shavasana practice. Please take as long as you like. I highly recommend at least 10 minutes, but you can stay as long as you like. More is often better, especially when there's a lot of stress going on in life. Take care, and I'll see you next time.